Good morning, Dr. Kimball and fellow classmates. Hope you are all doing well. According to the Iowa Board of Behavioral Science, 2019, the most common disciplinary action for ethics violations in the state of Iowa involve sexual relationships between counselors and clients. Although sexual misconduct was by far the most prevalent, other top violations include fraudulent reporting, record tampering, and criminal behavior that criminal behavior mostly tied to substance abuse. These common violations, especially the sexual misconduct, are not surprising to me at all. According to Capuana and Walla, 2016, the prevalence of sexual misconduct among mental health professionals is as high as 12%, which is shocking to read and see. They suggest that sexual attraction is normal in therapy. However, sexual misconduct results from the counselor's inability to identify and manage those sexual feelings. And this is often related to counselor impairment, resulting from a lack of self-care and emotional well-being. According to Lawson and Vernart, 2005, counselor impairment can happen when a therapist's personal and professional health and wellness has declined to the point that it is having an adverse and even unsafe effect on clients, leading to such things as sexual misconduct with clients or even criminal behavior. They suggest that burnout and substance abuse, personal crisis are some of the leading causes of impairment. Hunter, 2016, talks about the counselor impairment that can happen from, compassion fatigue, just that long-term, prolonged emotional, draining relationship with a client. Hendricks, Bradley, and Brogan, 2009, recommend counselors implement stress management strategies and self-care techniques which help them clearly define their professional duties and maintain those healthy boundaries with clients. When these kinds of things are lacking, impairment often occurs. They suggest a lack of love and friendship and even insufficient social supports outside of the professional counseling environment can lead to impairment. And so it's no surprise that Shackelford and Sanders in 2013 talk about some counselors having a strong need to be loved by their client, which can again lead to sexual misconduct. And so healthy, loving relationships outside of the professional counseling room can really help prevent impairment that might lead to those kinds of relationships. The ACA Code of Ethics addresses counselor impairment and wellness. According to ACA Code C2G, counselors are encouraged to maintain a healthy self-awareness of their physical, their mental, their emotional health, and even be willing to seek help if they begin to see signs of professional impairment. And if needed, counselors, according to the codes, need to be willing to limit their therapeutic activity and maybe even suspend it for a period of time until they can establish wellness again and even resume their work in a way that would be safe for the client. The ACA codes also encourage counselors to assist one another in recognizing impairment and even be willing to intervene if necessary for the protection of clients. My question pertains to the high percentage of sexual misconduct between therapists and clients. Although it is industry standard in professional counseling for counselors to provide therapy for people of the opposite sex, I wonder if that is best practice, given the highly relational, emotional nature of the counselor-client relationship. And are licensed professional counselors ethically obligated to provide counseling for someone of the opposite sex? Thanks so much.